honored to be here. I was very flattered that they asked me to share my story. It's been quite a struggle. I was diagnosed with lupus. They suspected MS initially in 1988. I hope everybody can hear me. If you can't hear me, let me know and I'll speak a little bit louder. I was officially diagnosed with lupus, which is an autoimmune disorder, and basically what that is my body attacks itself. Most people, when they get sick, your immune system kicks in to fight it. With my immune system, what it does is it goes into overdrive and it attacks what illness is attacking my body, but it also goes into overdrive and starts to attack healthy tissue, heart, lungs, nervous system, blood vessels in my case, and my kidneys. So as a result, I started having all kinds of trouble. Balance, vasculitis was one of the main things, a lot of trouble with kidneys, lungs, gastrointestinal problems was a big deal for me. But over the last, I'd say 10 years or so, started having trouble with numbness, tingling of my hands and my feet and my legs, a lot of achiness. For treatment for lupus, a lot of the medications were infusion with chemotherapies, was one of the big ones. I was going to a pain specialist for a lot of joint pain, a lot of joint swelling. I did have some falls, ended up with a pretty serious knee injury of the left knee, went through 7 surgeries, ended up with a knee replacement, was not real successful, so ended up being pretty sedentary, gaining a lot of weight, and ended up really being pretty miserable. Over the last 5 years, having a lot of leg pain, feet burning, hands. I love to crochet, getting very frustrated with not being able to do my favorite things. Playing with my grandkids, just getting any sleep. Ended up going to a pain specialist, going to a neurologist, being put on pain medication, Lyrica, as you saw the presentation, and the neurologist saying, yes, this is how we treat it. There's nothing we can do. And it's a combination, unfortunately, it is what it is. There's nothing we can do. We can treat it with the different medications and you're just gonna have to live with it. And it got to the point over the last, I'd say, year, where I just was waking up, having trouble going to sleep, restless legs, cramps, numbness, tingling, and over the last, I'd say probably 7-8 months, it got to the point 2 o'clock in the morning, I was awake, burning feet, horrible, and I'd get up and pace, just pace, because we have mostly tile in our house, and I was looking for anything cool, just to cool my feet off, and I was miserable. I was just miserable, so I'd go back to my pain specialist and complain to him, and they'd up the pain medication, up the Lyrica, and it just was getting worse and worse and worse. And I just was frustrated. I just was not having any quality of life anymore. I was getting more and more depressed. We were going on vacations, and he was doing the majority of the fun. And it really was not that fun for him. He'd come back and want to show me the pictures, and I don't want to see them. Because I was literally jealous, very jealous. On the other hand, it wasn't much fun for him either because he's doing it almost as a single person. And if we had one good day where I could go along, it was 3 days on the cruise ship or in the hotel room where I was trying to recover because I was in so much pain. And it just wasn't a life anymore. And I actually got a recommendation from my pain specialist that said, why don't you check into regenerative medicine? And I said, what is that? And he said it's stem cells. And he referred me to Innovative Medical, and lo and behold, COVID opened up, and they had, it was actually Zoom, I believe it was, and I watched Joe, and it was like, wow, I have to do something. And I started checking in, did a deep dive, and of all things, the Lupus Foundation was actually doing a study also. So I did a lot of checking into it, and I thought, you know what, I have to go and find out about it. And it's been completely life-changing for me. The combination of the whole entire staff, everybody has literally become like family for me. Graduation was bittersweet for me. I still am doing the rehab. I have like 5 visits left, but it's been completely life-changing for me. I don't have any of the joint pain. I'm sleeping at night. Lyrica, gone. I mean, it's, you know, it's amazing. And then I found out I was diagnosed with glaucoma, and the eye specialist said, you have to stop the Lyrica, because now they're finding out that Lyrica causes glaucoma. So it's like, seriously? I mean, is there anything that is not being caused by all the pharmaceutical stuff that we're being prescribed? And it was just covering it up, because when I went in for my evaluation and they did all of the testing on me, I could not believe how I was flunking and flunking and flunking and flunking all of these tests. And we got in the car that night and I was literally in tears. I couldn't believe how bad everything was. I wasn't feeling any of the pokes and all of the ways they tested. I knew I was bad. I didn't realize how bad I really was. But as I progressed, even a month, you know, they test you periodically as you're going through the treatments. And I couldn't believe the differences, and I forgot to bring the pictures, but I'm not in any pain. And what the poking and they test you with cold and hot and everything, I'm feeling everything again. So between the light therapy and the diet, you know, I don't even call it diet now. I've completely changed how I eat, because what's real important also, after having the injection, the IV, and I also had the injection in both knees, is eating right. Because you don't want to, once you have the stem cells done, you don't want to go putting bad food into your body, because it kind of counteracts everything that you're working towards. That has made a huge difference in me, gastrointestinal-wise and energy-wise. I have so much energy now, it's unbelievable. I mean, everybody that sees me, especially during the COVID when you were, you know, having to stay away from everybody, I saw my daughter after 2.5 months and she just looked at me and said, Mom, she was in tears. She said, Mom, I can't believe how you look like a whole different person. I'm playing with my granddaughter again, and I have, you know, I wasn't able to do that before because I hurt too much. So it's an unbelievable transformation. Doing dishes, I had, you know, the water on complete hot, you know, steaming hot. I didn't know it was that hot, but he would come in and wash his hands and he'd pull away and he'd say, whoa, you have the water way, way too hot. He said, what are you talking about? It didn't bother me. Now I can't handle it that hot anymore. So, yeah, I mean, I had no idea how much feeling I had lost in my hands and in my feet and in my legs, and I don't have the achiness in my legs anymore. The back pain is almost completely gone. I'm still working on that, but posture is better, and just overall, it's a complete different way of life for me now. And I really, honest to God, did not think I was going to make it. I'm 60. I'll be 61 in November. And the way I was looking before and feeling before, I honestly did not think I was going to make it to 65 physically and emotionally, because I was that depressed and that down. And now I can see myself, you know, he promised me 40 years. He thinks every year, we'll be married 19 years in September, and I keep saying, no, it's 40 years. You think every year you're losing. I said, no, it's 40 years. So.
Halfway there.
No, it's 40 years. So I'm counting on those 40 years. So, but I did not think I was going to be here, honestly, another 5 years. I honestly did not think so. the way I was going. And even my doctors now are just like, what are we going to do with you? We're going to lose you as a pain management patient the way you're going. And it's like, that's right. That's my
the
plan.
goal.
That's my
Sorry.
goal. So, yeah. So
That's
Awesome.
great.
their family, they honestly, everybody there is so loving and supportive, and there's not a day that goes by where even if I'm not feeling up to it, they're always there to encourage you. And I mean, they're full on, complete from start to finish, nutrition wise and physical therapy, and I mean, completely across the board. So there's nothing that you could need or want from the office there. So
One quick question.
yes.
And then I have a
So
quick
good.
question for Don. One quick question. Tell them about the Pepto-Bismol, how often you're
Oh,
drinking that
yes.
stuff, and how you don't
Imodium.
have to have it anymore.
Right. I was, gastrointestinal, I mean, this isn't a fun story to tell right before dinner, but it's the truth. I was basically to the point where I was on Imodium and Pepto-Bismol probably day in, day out.
Yeah.
I mean, and then when we sat down and talked about the cost of the program, first thing my husband said is, well, we're going to save that much on Imodium and Pepto-Bismol. Because I was to the point where, yeah, it's not cheap. You're doing the case-wise at Costco, And it was quite frankly embarrassing, because if I knew I had a doctor's appointment or going anywhere, I would not eat, for at least 12 hours before, because it was that bad for me. And I didn't realize until I started studying up that nerve damage also affects your gastrointestinal tract. And as you're losing that affects everything in your body, everything. It's not just our feet and our hands, it's everything in our body. It's our brain, and that's another thing. The Lyrica and the gabapentin, it's anti-seizure, but it gives you brain fog. And as I was coming off of that, it's like, whoa, I don't have the lupus brain as much as I thought, because I used to call it loopy brain, but a lot of it is the Lyrica and the gabapentin, because it's anti-seizure medication. And it gives you brain fog. So getting a clearer brain, and that's all part of it too, that they don't talk about, when they give you here's a prescription. And so, yeah, we're saving so much money on that. But it's not just that, though. Yeah, dollars, yeah, it's important. But when it comes down to it, I have my quality of life. I'm not parked in the bathroom and worrying about, okay, I can't eat for 12, 24 hours before I have to go somewhere. Now I'm eating, it's like when I checked with Taylor she said, check the DiCicco's. And it's like, okay, well, I know, okay, chicken, grilled chicken and sauteed veggies, and I'm good with that. And the anti-inflammatory diet, I don't call it a diet, my anti-inflammatory way of eating, you can eat everything. I mean, the tortillas, you can have, cassava flour. And I mean, there's all kinds of, ask me, I can make anything now. I make ice cream, I make all kinds of stuff now.
She brought in ice cream.
Yeah, I brought everybody ice cream. I made homemade out of coconut, milk and all kinds of stuff. So
Almond flour with
it's fun. It's a lot of fun. You can make Whole Foods, Sprouts. Everybody carries everything you need now. And it's really, really easy, and you feel so much better. So,
Awesome. Thank you. Quick question for Don. I'm just going to put him on the spot real quick. I know you probably weren't expecting you were going to answer a question. In brief terms, like, you don't have to go into it, but what are the biggest changes you've seen?
Well, can I go
Sure,
forward?
please.
Okay, so last year, for Marion's 60th birthday, I booked a trip for Italy because we've always wanted to see Italy. So I took her to Italy, and we went and saw Pompeii. We stayed on an island for 10 days, and then we would go into Italy. We would take a taxi to Italy, and we were doing Pompeii. And then for 2 days afterwards, she was down. She couldn't handle, she could handle 1 day out in the sun. Sun is a big drain for lupus patients. So I ended up going to the Coliseum the next day by myself. And then I went and saw Travis, the fountain,
Oh, Trevi.
Trevi Fountain by myself. And then, you know, and those are the things that when we go on a cruise, Marion would stay in the room. And I remember when we first got married, we came back from our honeymoon and she had to go right on to the chemo, the drip chemo because of her lupus. And all of the stress and everything going through a wedding, doing, you know, and then we went on our honeymoon, we came back, and she had to go down, you know, which basically she starts losing her hair and all of the, you know, because they put you on drip chemo for a 4-hour drip. That has gone away. We're not doing the chemo anymore. We're not doing, you know, we're going to take because of COVID, we haven't been able to get out, but we're going to take off to Arizona next week. So it'll be our first time out in quite a while. But just quality of life, you know, seeing, she like she said, she changed her diet. She changed the way she's eating and the way she's cooking. And I lost 10 pounds. You know?
That's good.
She's lost weight. The way there's, and I'm still eating, I was still eating regular ice cream, but she makes chocolate, like I like brownies and ice cream and all those, you know, chocolate cake and everything. And she's making cupcakes that have a few chocolate chips in them, which is dark chocolate, but it tastes like chocolate cake. It's chocolate cupcakes. She makes chocolate ice cream with cherries. She makes, she made a pineapple ice cream.
Coconut.
Yeah, pineapple.
It's easy. It's very easy. It's very good.
Really?
She's making everything with fresh vegetables, with, you know, it's just totally different. And I see the difference in the, in the energy that she has. And that was our goal. That was, I want to get out and in 6-7 more years, I want to retire and I want to buy a motorhome and I want to travel around. I want to go, you know, we have a condo club that we do. That's where we'll go to Italy or we'll go to, you know, I can't remember the other one, on a cruise to the Bahamas. We did, you know, and she can go out for like one day and then she has no more energy. And today she has so much more energy. And a lot of it is because of the change in her diet and the stem cells. I know that for a fact. It's only been in the last couple of, you know, her stomach issues. You know, we can't go very far away from a bathroom. We can't go up in the mountains because she has to stay close to a restroom. We can't do certain things because she has to, you know, those things have changed since she's done the stem cells and
Right.
changed her diet.
I had a basal cell, this was another thing, I had a basal cell cancer taken off of my chin, and it didn't heal, and I kept, you know how women are, we cover everything up with makeup, and I had the stem cell IV done April 20th, and by like the 27th of April, it was healed. It was like, holy cow, that was crazy. That was like, that was miraculous to me. I was like, seriously? So it was like, I mean, within 24 hours of having the IV stem cell done, no more Imodium, no more Pepto. I mean, it was just like immediate. It was like, that just was crazy to me. That was miraculous to me because that hadn't happened no matter how much Imodium I was taking. So it just, yeah,
And
just amazing.
I use the same lights that she uses on her feet. I
Right.
use them on my feet also.
Yes,
Because I have spurs on the heels of my feet from working on concrete and asphalt most of my life. I'm a maintenance man, that's what I do, I'm an electrician. And so my feet, my left foot in general, I have arthritis and it is so bad sometimes that it's hard for me to walk around without walking on the ball of my foot and staying off my heel. And
We'll see you
so,
tomorrow in the office.
Yeah, right. Well, when my lights, when I'm looking for my lights, I have to look, he's got them on his
Pull
foot.
'em off of his feet.
Yeah,
I
right.
don't know,
It's
I'm
like,
in the
no,
living
no.
room, she's in the bedroom, or I'll be in the bedroom, she'll be in the living room.
Awesome.
Yeah, so.
Well, thank you very much for
That's
coming
awesome.
tonight. It was awesome.